This is Dr. Mark Sutor, periodontist in Bloomington. I want to welcome you to my Facebook video. I just wanted to kind of be honest with you today and tell you that I've had a pretty long, hard day, like we all have in the working world. So usually I'd wait to have my glass of red wine, but you know what? I've decided I'm going to have it tonight. So I'm going to drink some Chianti as we talk about this great concept of digital radiography and the advances that we have in dentistry. But first of all, what I love to do is to toast to all the mothers in the country and wish you all a happy Mother's Day. I'd like to wish my wife a happy Mother's Day. My mom spent the weekend with us, and it was just a great reminder of how lucky we all are when we have the ability to, when we've been blessed with having a great mom. So I think this world really needs a lot of great parenting and the ones that have been blessed to have great parents. I wasn't blessed with a dad, so I had a mom that kind of played both roles for me. And she's 82 years old, and I'm really grateful for the way she raised me and my two brothers. We were not born with silver spoons in our mouths. We were pretty much blue-collar kids, and my mom drove a bus and pushed the broom in a high school and, taught us what hard work meant. So when I have hard days like this and feel like I've put in a long day, my mom did that for decades. So I appreciate the work that she put into our family, as well as a lot of mothers that around the country that do the same thing. And I really want to wish all you moms a happy Mother's Day this Sunday. So tonight what we want to talk about is the cool technology of CBCTs. So basically a CAT scan, right? In dentistry, we've had the luxury of being able to step into the 21st century and take the same technology that medicine has used and be able to implement that same 3D type of technology into dentistry. I bought my first CAT scan about 10 years ago. I was the first surgeon in Bloomington to have a CAT scan. And I think when I bought it, I think everybody thought I was kind of loony, wasn't quite sure what this newfangled technology would offer, but I kind of knew that the ability for that technology to offer me the surgical knowledge that it gave me to perform the kind of complicated procedures that I do for my patients, it was a no-brainer. And I was so lucky that I got involved a decade ago. And I'll talk about how it's kind of becoming the standard of care. It's not quite the standard of care yet, but I think soon it will be something that if you don't legally have a CAT scan, I think you could have some trouble. Hey, Courtney Blackwell, one of my dentist friends in Bedford, just joined. So she actually has a CAT scan in her general dentist office. She and her husband, Mike. Anyway, so what is a CAT scan? A CAT scan is a three-dimensional view of part of our body. So we're really familiar with how CAT scans are taken of our brain and other parts of our body. Well, nowadays, a dentist can take a CAT scan of pretty much this part of your face. It can be bigger, but most dentists will have a CAT scan that kind of incorporates this portion of your face, which for the majority of us is about all we see. Oral surgeons, plastic surgeons, they probably want to see your whole skull and your whole face. Myself, as well as my friendly general dentist, the most important things we're going to see are kind of in the sinus area all the way down to the base of our chin. So these CAT scans take different views. So did you know that a CAT scan has 80 to 90% less x-ray exposure? So when your dentist or myself takes a CAT scan, you're literally getting about 1/10 the exposure that you would get in a conventional x-ray. So one of the first things you should know about a CAT scan or any digital radiography, which we'll talk about next week, I'll actually bring you my little sensor and I'll show you how we can take intraoral smaller x-rays that are computer generated, just like this big x-ray. So a CT scan can be as simple as stepping into a machine that looks like just an open air type of device that you stand still in, and the scan goes around your head and in about 12 seconds, it actually takes 500 images of your face in this area, and they take them in very distinct small slices. So I tell patients it's kind of like taking slices of bread and looking at all the important structures of our head and neck, of our face, not our head and neck, but just this portion of our face. So that technology is becoming phenomenal for the things I do and the things that general dentists do. There are some general dentists that do that kind of CAT scan as part of their initial kind of examination and kind of information gathering. So if your dentist requires that or asks that, that's a great thing to do. Don't buck it. You know, when a patient comes and goes to a dentist that wants to take a CAT scan, I'm going to talk about the great things that your dentist can find out if you let them take a CAT scan. So let's talk about the benefit. So the best benefit of a CAT scan would be it allows your dentist and people like myself to diagnose and really perform better dentistry for you. And I'll give you some examples of how that's true. I'll give you some examples of how I use a CAT scan and how someone like my friend Courtney Blackwell Miskiff would use a CAT scan. So first thing I would do is I would take a CAT scan if somebody had impacted teeth. If any of you all have had kids or yourself where you had teeth that are stuck in your bone and your orthodontist says, boy, we've got to be able to expose those teeth and be able to orthodontically bring those teeth into a proper position so when you smile, your teeth are all in the right spaces. Sometimes these eye teeth are stuck up in your bone. And years ago, we'd have to take these complicated type of different angles of x-rays to try to figure out, are those teeth up in your palate or are they up here in underneath your lip? Now with a CAT scan, we can take a three-dimensional view and I can tell you exactly where those teeth are, exactly how the procedure can be done, and what the cost of that procedure would be. It really takes the guesswork out of that kind of procedure. So orthodontists and ourselves work with those kinds of images all the time to help figure out how your teeth, where your teeth need to be and how well they should be positioned. Impacted wisdom teeth. So I took out 4 wisdom teeth on a 21-year-old kid today. 2 of his upper ones were pretty simple and his 2 lower ones were pretty much laying sideways. So the benefit of taking a CAT scan in that scenario is you can see exactly where that tooth rests in relationship to the nerve of your jaw and also up in your sinus. So if there's any concerns about complications from those teeth being removed, your surgeon can say, okay, here's where the tooth is, here's where your nerve is. You can have a probability of having some nerve damage, or better yet, you're not going to have any nerve damage because I can see that that tooth is far enough away from the nerve. So impacted wisdom teeth, if they're complicated impactions, a CT scan would be a great thing to do. So you can sit down with your surgeon or your dentist and say, okay, what are my potential complications of having these teeth removed? It's awesome for that. Sinus areas. So I do a lot of implants. I've done 10,000 implants in my 25-year career. Very typical if you have implants placed back here where your sinuses are, that CAT scan will let me see the entire anatomy of your sinus, because you don't want somebody putting implants up in this part of your jaw if they don't know where your sinus is. So that I can literally take a computer generated implant and kind of pretend like I'm doing surgery for you and simulate where that implant will go on your x-ray before the surgery is even done. So how cool is that? So your surgeon can plan the surgery before the surgery is even done. So sinus area is really important. That really helps me determine what is the anatomy of your sinus? How much bone do you have? Do you have enough bone to put the implant in? Or do you need to have some kind of procedure done? It can help you with sinus infections. If someone, you know how bad it is to live in Indiana? We always get sinusitis and problems. I have seen so many people, I've taken a CAT scan, and I've literally diagnosed them to have sinusitis or inflammation or infections in their sinus purely from that CAT scan. I'm not trying to be an ENT, not trying to be your medical doctor, but I'm just telling you, when you take a scan like that, sometimes you find information that you didn't even know existed that you can help a patient treat so that they get better. So pretty cool. Root canals. Here's a classic example. If someone has had a root canal and they have pain with that root canal, sometimes root canal teeth break. It's not an uncommon scenario. With a CAT scan, you can turn the tooth around and look at it in all these different dimensions, and you can pick up root fractures that you can never see on a conventional x-ray. Because think about it, a normal x-ray is just a flat image, right? It's just a single image of something that's not flat, right? Our heads aren't flat. So a three-dimensional view allows you to turn the tooth around and hopefully find some things that are related to why do you still have pain with that tooth. It's not uncommon for me to take an x-ray like that or have an endodontist. Remember we talked about root canal therapy? An endodontist can take an x-ray like that and tell you the condition of the root canal or tell you whether a teeth needs a root canal. Remember we talked about how the nerve dies last week? Sometimes an endodontist can take a three-dimensional x-ray and believe it or not, you'll see an infection on that CT scan that you won't see on all the other images that you take. I have tons of examples where I've taken a small picture, a big picture called a Panorex, and I didn't see any infection and the patient was having discomfort. I convinced them to let me take the CAT scan, and all of a sudden I saw an infection around a tooth that I literally did not see around all the other flat images, because a flat image doesn't give you the same perspective as a three-dimensional image. So root canals can be a huge diagnostic. You can really diagnose root canal problems, or teeth that you didn't know needed a root canal. And all of a sudden you see this consideration or problem on the x-ray, and then you can properly treat it. It's really a big benefit. So nerve locations, if you're doing any kind of procedure, if you have any kind of infection in your bone, you want to know where your nerve is. So that nerve of your jaw runs through your jaw and kind of ends right about here. And then there's another nerve that goes like that. So if there's issues with that nerve, that CT scan can literally look at that jaw and see where the nerve innervates inside your jaw and be able to determine whether there's any kind of nerve damage or any kind of involvement with your nerve. So I think that's really important. I have seen people who have had literally bony diseases, bone cancer, bony infections, conditions in their jaw that you really just wouldn't see on a conventional picture. So that three-dimensional image allows you to see things inside your jaw all throughout here and throughout here that you would typically not be able to see with a conventional picture. So that type of benefit for your dentist or your surgeon, it's enormous, you guys, to be able to help treat you better. So you can also tell how dense your bone is. Not really for like osteoporosis, but more for how healthy is your jawbone around your teeth. So I'm a periodontist, right? So I help people hopefully keep their teeth for a long period of time. Hey, Andrew Watkins, another dentist in Bloomington, just joined. He's a good young dentist that works with his dad. I coached him in football when he was about 6th grade, 7th grade. So anyway, gum disease. So remember how we talked about periodontal disease? I can take a CAT scan and see how healthy your bone is around your teeth. So if you wanted to know how much jaw structure you had around your teeth and how healthy your periodontal condition is, then you can actually take that kind of scan and see where is your bone around your teeth, and you can be able to tell how much bone loss you've had around your teeth, especially your back teeth. If you lose bone in between the roots of the teeth, we'll talk about how we can do bone grafts and things like that later to save teeth. So you can diagnose periodontal disease. Your dentist could take an x-ray, see exactly how much bone you have in combination with those measurements that we talked about a few weeks ago. That is an awesome way to be able to tell the health of your mouth. There's one scan picture where you can see your entire skull as if you didn't have any tissue around it at all. So you can take this image that you can see your upper and lower teeth, and you can move that image around in all kinds of dimensions and literally be able to see what your entire skull structure looks like. It's really valuable information. So if your dentist mentions the benefit of taking a CAT scan, or you wonder, do I really need that CAT scan? Most CAT scans can range from a couple $100 to $400. But I would tell you, if you had that information and your dentist was going to be able to prevent you from having thousands of dollars of dental problems, I mean, do the math. You know, it's a great thing to have that kind of information to allow your dentist to do a better job for you. So to me, If your dentist suggests that you need a CAT scan, or if we suggest it, I would really thank them, because the reality is they're going to be able to do a better job with that information, and they're going to be able to diagnose things properly so that your dentistry is really well done. So the term is called CBCT, computer, just a cone beam computer CAT scan kind of thing. If you hear someone say, I want to take a CAT scan or a CT scan, it's all the same information. So think about that type of radiography as a three-dimensional view of your teeth and your bones and even the surrounding structures kind of in this area. Most of us dentists will take an x-ray that'll kind of take this much of your face. Oral surgeons and maybe some orthodontists would take a picture of your whole head because they're looking for other information. But you also need to make sure that when you take that picture that all the information is read properly. Sometimes they'll send it to a radiologist to make sure nothing's missed and that all the possible conditions are evaluated. So I hope this was helpful. I think I'll finish the rest of my Chianti. I wish all the moms in the country a happy Mother's Day, and look forward to seeing you next week. And you got to remember, go Hoosiers. Good night.